Okay, Bismillah ar-Rahim. We'll start with the first case with Dr. Noha. Dr. Noha, are you ready?
Okay. إن شاء الله.
استمع لكوميونيكيشن يا دكتور صالح.
miscellaneous يا دكتور.
نعم.
يا دكتور ماجد هيبقى يعني واحدة communication، واحدة history، واحدة station 5 إن شاء الله. Okay, the first case. Mr. Magdi is 27 years old. He has been complaining of right knee pain for the last 2 weeks. Right knee pain and swelling for the last 2 weeks. He is known in case of diabetes mellitus type 1 as well. Blood tests done for him, including iron profile, and the diagnosis of Haemochromatosis has been confirmed to his condition. You are senior health officer of the medical department. You are asked to discuss the result of the blood test with him.
Okay. Just
You
2
have
minutes.
3 to 5 minutes to prepare yourself and write your skeleton and your scheme until to go to meet the patient or the surrogate.
Okay.
This is a fresh case. Just came in Egypt this night, yesterday. معنا الدكتور حسام أول مرة يحضر. دكتور حسام الدين.
أيوة السلام عليكم دكتور صالح.
وعليكم السلام ورحمة الله.
ازيك يا باشا، اخبارك ايه؟
انت منورنا يا فندم.
نورك الله يخليك، ربنا يبارك لك.
انت داخل امتحان قريب؟
انا ان شاء الله عندي امتحان يوم الاربعاء اللي هو بعد حوالي 10 ايام دلوقتي يعني.
يا راجل.
يا ان شاء الله باذن الله.
ده فين يا دكتور حسام؟
في بروناي. انا كلمت حضرتك من فتره على بروناي.
والله؟
ان شاء الله باذن الله.
انا مش واخد بالي خالص لان هو الاسم على الفيس مختلف عن الاسم هنا، مش كده؟
لا هو حسام بره.
واخبار الفيزا، انت اللي كنت ديبريز جدا عشان الفيزا ما جاتش.
لا الحمد لله جات لي وجات للاولاد كمان.
طب الحمد لله. قلت لك هتتاخر شويه بس هتيجي يعني.
الحمد لله يعني هي جت حوالي 3 ايام او 4 ايام.
انجوي في بروناي بقى.
يا ربنا يسهل يا رب، بس الامتحان يعدي على خير.
لا ان شاء الله يعدي. خلاص انت ليك حاله معانا النهارده بقى يعني.
معلش انا اسف.
ليك حالة معانا النهاردة بقى طالما داخل امتحان إن شاء الله.
ان شاء الله باذن الله.
Okay, Dr. Saleh.
Okay, we can start.
Okay.
اوكي.
Good morning, Mr. Magdi.
Good morning, doctor.
I'm Dr. Noha, Senior House Officer in the Medical Department. Nice to meet you.
Nice to meet you, doctor.
Out of respect, you are Mr. Magdi, 27 years old.
Yes, doctor, I'm the one.
We are here today to discuss your medical condition, if you don't mind.
It's okay, doctor.
Do you have you want any one of your family to attend this meeting?
No, doctor, I can manage myself.
Okay, Mr. Magdi, anyone told you about the investigations we had done for you?
No, doctor, they told me they are going to do some blood tests to know what's going on with me and what the underlying cause of my joint pain, doctor.
And what about your expectation? Do you have any idea what it
No,
might be?
doctor, I'm not sure about that.
Mr. Magdi, the results of your blood test have been revealed, and I'm sorry, it is not as we hoped.
Why, doctor? Is there something serious?
Actually, the results show a disease called Haemochromatosis. Do you have any idea about this disease?
No, doctor, this is the first time to hear about it.
Okay, you want to know everything about this disease? I
Yes,
can
please,
explain to
doctor.
you. Okay, this is a genetic disease. It means it can run in families. There is a problem in iron deposition in your body. It is deposited in tissues abnormally, like your heart, your skin, your liver, and many other sites. It can have many manifestations, like increased blood sugar, the knee swelling and pain, and sometimes it can cause skin pigmentation. Also, it can cause heart problems and sometimes a problem in the intimate relationship.
Yes, doctor.
I'm sorry for that, Mr. Magdi.
Yes, there is treatment for this disease.
There is treatment for this disease. It is for control of the symptoms. It's not a cure, actually.
So it is not curable condition, doctor?
Not a curable condition. Sorry for that. It's controllable condition.
Oh my God. This is very bad news for me today, doctor.
I'm so sorry for that, Mr. Magdi. Be sure we are going to help you as much as we can. And we will be followed up with a multidisciplinary team, including a blood doctor and psychiatric support if you need, and specialist nurse. And we'll keep an eye on you.
So what treatment you are going to give me, doctor, for this disease?
Treatment include the venesection and
What do you mean by venesection, doctor?
I mean we can remove some of the blood.
Why, doctor?
I'm not sure about it actually.
Is there any problem with my blood, doctor?
There will be abnormal deposition of iron inside your body. أنا مش فاكرة التريتمنت صراحة.
Okay, venesection is okay. So How you are going to do this venosection, doctor?
By inserting a needle and removing some of the blood that contain much iron.
Yes, doctor. That's all?
And this is to control your symptoms. Some of the symptoms will be reversed, like heart problem and skin pigmentation. Unfortunately, some of the problems are not are irreversible. That means it will not be corrected. Like if you have high blood sugar, we will give you treatment for this high blood sugar, but will not go away. Also, liver cirrhosis.
Yes. What do you mean by liver cirrhosis, doctor? Hello? Dr. Anoha, are you there? I think there is a problem with Dr. Anoha internet. We are trying to call back.
Liver is gone.
Okay, so like that, we'll start with another one. I'm sorry,
أي
Dr.
حد
Anoha.
ممكن
Okay.
يتصرف.
Okay, we can do it with
أي حد أي
with
حد
Dr.
أي
Hussein.
حد يكمل الحال.
We'll start from the beginning. Dr. Hussein, are you
Hello.
ready for this case?
begin الآن.
I'm sorry, Dr. Sadiq, but I was not hearing from the beginning, so I don't have the whole details. Is it just breaking bad news about diagnosis of hemochromatosis? Explain the diagnosis or
Yes, I'll
something
give you
else?
the scenario again. Mr. Magdi is 27 years old. He has been complaining of right knee swelling and pain for the last 2 weeks. His known case of diabetes type 1 as well. Blood investigation done for him involving iron profile and the diagnosis of hemochromatosis has been confirmed to his condition. You are senior officer of the medical department. You are asked to discuss the result with him. You have 3 minutes to prepare yourself for the case and to arrange your thoughts.
Okay, Dr. Sadiq, I'm ready.
Okay, you can start.
Yes?
Okay.
Good morning, sir. I am Dr. Hashim, the senior house officer in the outpatient clinic. I'm speaking to Mr. Magdi.
Yes, Doctor, I'm Mr. Magdi.
do you have any idea about our meeting today and what it is about?
Yes, doctor. I'm coming today to discuss the result of my blood test.
And how is your knee now? Is it doing well?
What, doctor?
What about your knee pain and your knee problem? Is it
It's okay
getting-
now, doctor. The pain now is improved with some painkillers.
condition?
The sound is interrupted, Dr. Hussein. I'm sorry.
Do you have any thoughts about the diagnosis of your
No, doctor, I'm not sure about it. I'm not sure what could I have.
Unfortunately, your blood test came back with a result of some disease that is called hemochromatosis.
Is it serious,
So
doctor?
did you hear? It's not serious. It is controlled, but it has many effects on different organs of your body. So did you hear anything about this disease before, or you read about it before anywhere?
No, doctor, this is the first time to hear about it.
So it would be good for you if you would know about, if you would know more about this.
Yes, please, doctor.
Okay, I will try to be simple as possible. First, this is some disease that is called genetic disease. It comes with some disturbance in the genes of your body earlier in your formation, and it is passed through families. So you got this abnormal gene from one of your parents and was transferred to you. This gene is responsible for simply for the iron movement inside your body and iron storage, which is causing the iron to be deposited in different organs of your body. So you are with me until now. If there's anything you like to know about, you can
Yes,
ask. You are
doctor,
can
I'm following you completely.
you have free to ask. So you are free to ask me anytime if you or interrupt me. Like to ask about something, okay?
Okay, doctor.
So this disease, unfortunately, goes split in different parts of your body, like your heart, your some gland, which called the myoclonic gland in your brain, your pancreas, which is responsible. Groans like your skin. This condition needs good care and good follow up. So you have any good about it?
Yes, doctor. What system, doctor, are involved in this disease? Because the voice is interrupted.
This disease, this iron can be deposited in different parts of your body, like your liver, like your in your tongue,
The net.
or blood sugar.
I'm sorry, but anyone here, Dr. Hussein?
ده احنا سامعينك.
Hello?
Dr. Hussein, يعني صوتك يعني is interrupted when you're mentioning the systems are affected.
I'm sorry. I'll mention them again.
Yes.
Yes, please.
This iron it can be deposited in different organs of your body, like your liver, your heart, the myoclonic gland in your brain, which is called the pituitary gland.
Yeah.
Also, the pancreas, which is responsible for the control of your blood sugar.
Yes.
So we have to deal with this iron, and we have to get rid of this iron, not to be deposited in this. And this is the cornerstone of our management.
Yes, doctor. And you can give me treatment to cure this condition, doctor?
I'm sorry, it is not curable, but it is controllable if you are giving the appropriate treatment and you're following the appropriately the instructions that's going to be given to you.
Yes, doctor.
So what other concerns do you have about this condition? If you would like to ask, I would be happy to answer any concern you have.
Yeah, you told me, doctor. Just best I'll ask anyone that have a challenge to mute the mic, please. Because the voice is interrupted. Yes, doctor, you told me that there is treatment. What are you going to do for me, doctor?
First of all, we have to do some genetic testing to find what is the mode of transferring the gene to the siblings, so we can predict the percentage of your siblings that are going to be affected. Second of all, we'll make an arrangement with multidisciplinary team, including doctors specialized in the organs that are going to be affected by this iron error. Excuse me, sir. Hello?
There is a lot of echo. Please, the one who's opening the mic to mute the mic because of a lot of echo coming out. Okay, that's okay. You can continue, doctor.
Now you're hearing me well?
Yes.
So I repeat again that first of all we'll do some genetic tests to make sure about the possibility of transferring this abnormal gene to your siblings. And second of all, that we are going to arrange a
Yes. Please. To mute the mic, please. There's a lot of echo, like a war.
Hello?
الايكو ده من عندك يا دكتور حسام؟
نعم؟
لا الايكو ده من عندك؟
لا انا ما بتكلم، مفيش صوت دوشه من عندي خالص.
طب يعني بليز بس يا جماعه to mute the mics to make the voice clear. Okay, you can continue, doctor.
So shall I repeat again the management plan?
No, it's okay. What after this genetic test, doctor, to know? I don't know from where this echoing.
I'm hearing this voice, this noise also.
Yeah.
So it is not coming from my mic.
Oh, it's okay. معلش مرة أخيرة يا جماعة أرجوكم يعني to mute the mics عشان الإيكو بس. في a lot of noisy echo coming out. Yes, doctor. What after the genetic test know what if my siblings has disease or not?
We arrange a multidisciplinary team, including the hematologist and other somebody specialized in the blood disease, and also we'll arrange also with some with other specialists that are specialized in the system that are going to be involved, like the doctor specialized in the heart, doctor specialized in the liver, and also arrange with an occupational therapist and a social worker to be involved in this team. Regarding the pharmacological treatment, as we said before, that it is not a curable disease, it is a controllable disease. So our cornerstone of treatment will be to get rid of this excess iron that is going to be deposited in different organs, and this is by using some iron, what's called iron chelating or iron binder agents, and also if we in urgent need that we are going to get rid of some blood, so this will remove excess iron from blood.
Yes, doctor. And how many times you are going to make this removal of blood for me, doctor?
Actually, you have a cut-off level of what's called hemoglobin in your blood. This cut-off level, this will guide us when and how often we're going to do this, how we're going to get rid of this blood.
Yes, doctor. And doctor, I'm not going to be anemic because of this blood removal, doctor.
Sometimes we put people like in your condition in this low cut and the low range of the hemoglobin level, so to make sure that there is no excess iron in the blood.
Yes, doctor.
So, sir, do you have any other question about the condition? If you are going to, you need another opinion, you need to arrange another meeting.
No, it's okay, doctor. I trust you.
So, can we summarize what we have said in our meeting today?
No, doctor, what about, you told me that it is a familial disease. So what about my children, doctor? My children may have the disease as well. I have 2 children, doctor, and I'm married. You didn't ask me about social history at all and about my job. So this disease can be transmitted to my children, doctor?
Unfortunately, I'm sorry to tell you that there is a possibility that this disease could be transferred to your children, and the possibility could be around 50%.
So, doctor, can we do for them this test now to know if they have the disease or not?
Excuse me?
Can we do for them the test to know if they have the disease or not?
How old are they?
Yes, doctor, I have one is 5 years old and the other is 7 years old.
Unfortunately, I'm sorry, we don't do genetic testing on children until they are 18 years old.
Yes, doctor, but I think if you do this test now, we can know the disease and you can start your treatment plan early and to avoid complications, doctor.
As I told you, sir, this condition is not curable, and also to be manifested and cause complications, it's not until the early adulthood.
Yes,
so there is no harm for your kids to be not to be tested now.
Yes, doctor.
So, sir, do you have any other concern about this condition or
No, it's okay,
about
doctor.
this? So we will arrange another meeting for you to do this, to continue our blood testing, and also to detect if you are going to need to get rid of some blood or not, and to discuss the multidisciplinary plan, our multidisciplinary plan.
Yes, doctor.
Thank you, sir.
Thank you, doctor.
شكرا يا فندم.
Okay, shukran, Dr. Hussein. Discussion with the examiner. Okay, doctor, so do you think that you explained everything about the disease for the patient?
Almost most of the disease problems and what he wanted to know about it.
Yes, what about his children, doctor? His children may have the disease, and you told them that we are not going to do testing for your children until they to be adult. Do you think this is a good idea?
Excuse me?
Do you think it's a good idea to postpone the genetic test for the children until to be adult and to complain from the complication of the disease?
Actually, it is not ethical to do genetic testing on minors, and on the other side, the condition would not be manifested until early adulthood.
Yeah, but I think if you detected the gene and the disease early, the children can be treated early and they can have good follow-up from the beginning. Okay, what about the social history, doctor? You didn't ask about the patient job and how much his job affected because of the symptoms and usual daily activities as well.
No, sir, I didn't actually. Unfortunately,
No, you didn't ask about the smoking history as well, and because smoking can worsen his heart condition, and alcohol history because alcohol can worsen his heart condition and liver condition as well, isn't it?
Yes, sir. Yes, sir. Yes.
Okay, so social history is very important to ask about. Okay. Anything else? Okay, we will do open discussion. For anyone has any idea to speak about.
يا دكتور صادق السلام عليكم.
تفضل دكتور. وعليكم
دكتور
السلام يا
صادق.
دكتور ماجد. تفضل.
يا دكتور صادق السلام عليكم. حضرتك في الحالة اللي زي كده مش احنا ممكن محتاجين نعمل ديسكشن عن الانفورمد كونسنت للجيناتيك تيستنج نتكلموا اكتر على ان هو we will make for him genetic testing for him and for his siblings and we need informed consent and try to explain more about informed consent.
طبعا هنا
ولا no need في الحالة اللي زي كده ان احنا نتكلم.
مهمة جدا for all the siblings يعني for the sisters, for the brothers and for his children.
هو بقى ستوري دكتور صادق. يعني هو اعتقد ان السكوب بتاع الكيس مش ان انت you are going to do a genetic test. السكوب how to explain a diagnosis.
انا معاك يا دكتور. احنا مش هناخد الديتيلز about genetic test. لكن احنا عندنا hereditary disease autosomal dominant, فبالتالي this disease may his children or his sister or brother may have the disease. So screening is very important. You have to talk about screening, not in details, okay, but you have to give idea about screening. You have to ask about him about social history. What about your brothers, your sisters? They are well. They have any complaint at all? What about your children? They are doing well. Okay, so as this disease is familial disease, so it is advised that all your family members to be tested genetically for this disease, because if we detect the disease early as possible, we can start our treatment plan and regular follow-up as early as possible and to avoid complications in the future. And if they agree to do the test, you have to sign consent for agreement about this test. Is it okay with you?
Yes, but this could be discussed in a further meeting, but not at this meeting.
ما هو فيرسر ميتنج بقى لو انت يعني هتتكلم عن جينيتك تيست يا دكتور حسام يبقى بالتفصيل بقى الفولس بوزيتيف والفولس نيجاتيف والكونفيدنشاليتي والمش عارف ايه والكلام ده، بس احنا هندي هنا هنت
and I think it was not that بالظبط هي هتدي هنت بس ان انت هتعمل جينيتك تيستنج وان انت هتارينج another meeting for the genetic testing ودiscuss بقى الايشو بتاع الجينيتك تيستنج.
تمام. and I refer you to a genetic test team to discuss all the issues about this test. And
that's okay.
Any other comment?
طيب دكتور صادق معلش الفيري سيكشن الفيري يعني I think it's better to give more in about very section how to come out many times per weeks like this.
هو الدكتور حسام يعني ناقش يعني قالها بشكل كويس مختصر لكن بشكل كويس ان هو it will be repeated according to the level of your hemoglobin and your iron deposition in your body and until to be controlled. So it will be repeated according to the level of your hemoglobin and iron deposit. Maybe in the beginning maybe one time every 2 weeks and then maybe one time every 1 month, and after that according to the result of your blood test and the load of iron in your body.
معلش دكتور صادق برضه هو يعني السكوب بتاع الميتنج مع البيشنت دوت هو الاكسبلين دايجنوزس ان بريف، يعني لان انا لو قعدت فتحت معاه في كل مواضيع المانجمنت وكده مش هيكفي ربع ساعه يعني. فهو المفروض ان انا بريفلي بديك في دايجنوزس ده عباره عن ايه، يعني هو ده اكسبلين دايجنوزس اتكلم عن الانستنس وعلى البريفالنس وعلى الكلينيكال بيكتشر وهاو ات اوكيرز او الباثوجينيسيس والمانجمنت بلان ان سكيم وين تو سيك urgent medical treatment. يعني انا اعتقد ان هي دي البوينتس اللي should be discussed in the meeting يعني.
هو عموما يا دكتور حسام يعني اي chronic illness او يعني counseling for chronic illness you have to explain what the disease simply without jargons, complications and symptoms of the disease and management plan of the disease. طبعا انت مش مطلوب منك يعني تشرح المانجمنت بلان in details. اوكي
ما انا قصدي كده يعني حتى لو انت اتزنقت، كانوا دايما بيقولوا لنا لو انت اتزنقت في الكيس يعني يقول لنا I will refer you to the doctor specialized in the disease or doctor specialized in blood disease for example in this case. he will explain further. يعني هي دي حصلت معايا حتى الاكزامينر قال لي كده، يعني قال لي يعني you tackle it او يعني you pass by this issue by referring the patient to the doctor specialized in the case. يعني هم يحبوا يسمعوا جدا انت we refer you to a doctor specialized in this. يعني اعتقد
طبعا الريفرال ده اساسي طبعا، ريفرال تو مالتي ديسبلينري تيم وتوضح له مالتي ديسبلينري تيم from زي ما انت قلت heart physician and the gland physician and liver physician and maybe brain physician and the internist as well for your diabetes to control your condition and to give you the appropriate treatment plan. لكن it's not harmful to talk about venesection. They are going to give you treatment. The main issue of the treatment will be in the form of venesection. It means that repeated blood removal from your body to decrease the iron load in your body. مش هتتكلم عنها in details يا دكتور حسام، بس تدي hint. يعني هو حتى هو سألك what could be the treatment دكتور، وعايز برضه ياخد فكره. يعني ما هو ريفرال وبس، انا عامل لك ريفرال وخلاص، اديله هنت برضه about the treatment.
لا انا مش بتكلم على بالعكس انا explained ان هو الكورنر ستون بتاع التريتمنت ان احنا ريموف الايرون دوت عن طريق كذا ستيب اللي احنا هنعملهم. انما انا بتكلم على to go deep inside the management details. هي دي اللي ساعات ممكن يعني تنقص درجات من الواحد من غير ما يشعر، يعني لان هو ممكن تمس something.
انا معك. يعني هو انت هتقوله ان the main treatment will be in the form of frequent removal of the iron of the blood to decrease the iron load in your body. مش هتقول له بقى every قد ايه when your hemoglobin is ايه. لو سألك how frequent ممكن تجاوبه بالشكل ده. It will be repeated according to your iron deposition or iron load in your body, your hemoglobin level and the iron level in your body. Right? لكن مش in details. اوكي طيب.
ايوه
any other comment؟
هو بس حاجه كمان عايز اضيفها، انا برضو مست في الحاله ديت ان هو should at the end offer him some leaflets and some websites to read more or further about this.
الهلب طبعا في الاخر ده مهم جدا. اوكي
بالظبط. دي I missed. admit ان انا مست الحته دي.
اتفضل.
اوكي يا دكتور عمرو اتفضل.
الديزيز اوتوزومال ريسيسيف ممكن ان 50% ويل
ده 25% كده.
25 هو اوتوزومال ريسيسيف. سوري هو 25%.
25%. اوكي. any other comment؟
ممكن اقل من
الو
ايوه دكتور
عمرو. ده ممكن اقل كمان من 25، اقل من 25 بس كمان.
اوتوزومال ريسيسيف يبقى 25%.
لو هو الفيميل كمان كانت كاري زاجين.
لا لو
هو اوتوزومال ريسيسيف.
لو only one. معلش يا جماعه انا في عندي كونفليكت. هو اي حاجه هيرديتري، اعتقد هيرديتري هيموكروماتوزس اي حاجه هيريديتري تبقى اوتوسومال دومينانت، بس انا فاكر ان الهيموكروماتوز اوتوسومال ريسيسيف.
اوتوسومال ريسيسيف
والويلسون ريسيسيف برضه.
هو اوتوسومال ريسيسيف يس. اوكي.
ما يعنيش ان 25% من البيشنت ده لو هو اتجوز واحده هيبقى 25%.
امال يا دكتور
لا هو حتى لو هو كارير وهي كارير،
لو
هو
هو
قصدي حضرتك
كارير
ان هو
وهو كارير.
افكتد فهو في 50% زي ما انا قلت صح؟ يعني
لو هو
50%
لو هو افكتيف
يعني
فعلا هيبقى 25% برضه.
قصدك لو المادر
لو
50% هيبقى
affected.
كارير.
اوكي. لو المادر
هيبقى
والفادر
100%.
affected هيبقى
100%.
25%.
يبقى 100%.
لا لو الاثنين كاريرز هيبقوا 25%. لو
بالظبط، لو
الاثنين
كارير هيبقى 25%.
لو الاثنين كاريرز، بس هو لو افكتد، لو الوايف كارير هيبقى 50%، لو الوايف مش كارير هيبقى 0%.
بالظبط.
هو
لو
طالما هو
الوايف كارير،
affected
لو
غالبا
الوايف مش كارير، لو الوايف مش كارير ممكن يكونوا كومبليتلي نورمال، يعني مش هيبقى فيه حاجه
ما
خالص.
بالظبط هيبقى 0%، الافكشن هيبقى 0%، بس هيبقى الكاريرز 50%، هيبقى 100%.
معلش يا جماعه، هو بس لما يبقى البيشنت اوتوسومال دومينانت اوكي and the partner is normal so the percent would be 50%. اوكي.
ولو تمام، بس لو في الريسيسيف، لو البيشنت افكتد والبارتنر كارير بيبقى 50% مش 25 ده لما يكون الاثنين كاريرز.
طيب لو البيشنت افكتد والبارتنر نورمال
هيبقى كلهم كاريرز.
هيبقى مش هيأفكتد، يعني هيبقى مش هيبقى معظم
هيبقى كلهم كاريرز، بس هيبقى 100% كاريرز.
كله كارير 100% كارير.
ومش كله كارير كمان.
ايوه
لا كله، لان هو هياخد شيء من الفتره هياخدوها يعني، لازم يبقوا كاريرز، استحاله يبقوا نورمال.
اوكي.
كله كارير. كله كارير.
هيبقى كله كارير.
Okay. What about the communication?
بس هو طالما الفادر افكتد يبقى البوسيبيليتي من 0 ل 50%، يا 0 يا 50.
طيب what about the communications and symptoms of the disease?
Excuse me, sir?
Communications and symptoms of the disease, do you think that you explained all the communications and symptoms of the disease?
It was not explained in details. Just mentioned that it could be deposited in different parts of the body, so needs good care and follow up of these organs or systems.
Yes. Yes, but you have to mention.
But if he asks about what is the effect of my heart, I should explain further about this, or what is the effect on my glands, or what is the effect on my fertility, for example. ساعتها اقدر بقى explain ان هو هيعمل كذا وهيقلل كذا ونعرف كذا، يعني هيبقى more detailed. انما طول ما هو ما سالش، عشان كده انا كل شويه بقى what's your concern على اساس ان هو لو في حاجه هو محتاج يعرفها in details انا اشرحها له في النص.
بص يا دكتور حسام، السيروجيت مش هيقعد يسالك كل شويه عن كل حاجه، تمام؟ هو حافظ السؤالين اللي يسالهم في الاخر وخلاص بتوع الكونسيرن، لكن مش هيسالك what's the symptoms and the complications and how my heart is affected and how my endometrial relationship will be affected. هو مش هيسالك الحاجات دي، انت لازم تقولها، تمام؟ انت كويس انك قلت له if you have any question at any time you can stop me at any time. This is very good in the patient welfare. لكن البيشنت مش كل شويه، هو مش فاهم، هو حافظ، هو مش عارف السيمتومز والكومبليكيشنز، هو حافظ سؤالين هيسالهم في الاخر في كونسيرن وخلاص، ويقعد يمثل ويعمل لك ان هو بيعيط وان هو متاثر وبتاع. لكن انت لازم تشرح كل حاجه
بالظبط
للسيروجيت، تمام؟ not in details.
تمام.
معاك not in details, don't push a lot of information to the patient. I agree with you. لكن you have to reach all the informations simply and focus for the patient. يعني for example in the complication and symptoms of the disease. So this condition is a multi-system condition due to the position of the iron in multiple system in the brain, causing problem in the endometrial relationship, in the liver causing liver problem and there may be liver failure in the long run, and the heart causing heart failure and maybe some symptoms of shortness of breath and leg swelling in the long run. Deposition in the pancreas and causing diabetes mellitus. Deposition in the joint is causing this joint pain, like the joint pain you have. Deposition
carpal
in
tunnel.
ممكن يعني بس ماشي okay. Deposition in the skin causing a tanning of the skin. لازم to mention all the complications and symptoms. يعني ما تسيبوش can be deposit in your heart and your brain and your pancreas and your liver. طب وبعدين طب أنا أسفر من إيه بعدين؟ لازم to be honest with the patient and to transfer all the information for the patient that is going to suffer from a lot of complications and symptoms in the future in the long run.
تمام.
نقطة تانية يا دكتور حسام انت
كمان يا دكتور صادق نتقالب نديله
معلش عشان دكتور حسام داخل الامتحان. You are stopping a lot and making the patient to guide you, okay? And you are asking the patient frequently. You have to move in your case, explaining the disease, complication of the disease, treatment plan, and if the patient has any question, he is going to stop you. Don't worry about that. But like that, you are wasting a lot of time.
But there is no purpose in breaking the news and giving him the information.
I agree with you. You have to stop in some time.
And I should give him also.
Okay, but you have as well to inform the patient about all the complications. تفضل يا دكتور حسين. طيب like that we explained the disease. Dr. Hussein explained the disease appropriately and the complication and symptoms of the disease for each system. Okay, and the treatment plan that we are going to refer you to a multidisciplinary team from a liver doctor, gland doctor, and the brain doctor, and joint doctor as well, social worker, and occupational health care psychiatrist to give you the appropriate plan of management and to help you as much as they can. The treatment plan will be mainly by venous section. It means that repeated blood removal of the blood from your body to make the iron within normal level. Okay. طيب في حاجات تانية للبيشنت دي ده مثلا زي ان هو عنده impotence. You have to help him in this issue. Okay. وده
هو عنده ايه يا فندم؟
impotence.
impotence تمام.
This is something important for the patient and may affect the patient social life and his psychological status. ده هيكون included برضو في multidisciplinary team يعني.
الفيرتيليتي دكتور.
تمام. في حاجة تانية بالنسبة للبيشنت ده الدايت. This patient you have to involve the dietitian as well in the multidisciplinary team. Okay. And this patient has to avoid
dietitian, yes.
Vitamin supplements and the diets which contain iron. Okay.
High iron diet.
Iron-rich diets, and also to avoid the diets containing vitamin C. Okay.
Vitamin C. عشان يزودش absorption.
And the liver, the kidney, and the red meat. All of these are rich with iron. Okay. So عشان ما تخشش في details برضو بتاع الدايت. Some foods are rich with iron. Okay. So that you have to avoid not to increase your iron load in the body, and we are going to refer you also to a dietitian to give you the list of the diets which is free from the iron. وشكرا وكفى الله من شر الفتن. بدل special advice
تمام.
for the diet. Okay.
ممتاز.
السوشيال لايف يا دكتور حسام مهمة جدا. Don't forget in the exam, if you forget the social history, your mark will be decreased a lot.
And job.
What the patient, what did you as a,
Thanks
can
to
I
the
ask you
paper.
some social question please? What did you do as a job? And how much the symptoms affect your job and usual daily activities? We refer the patient to social worker if his usual daily activities is affected. Refer the patient to occupational health care if his job is affected. With whom you are living? Okay, what about your endometrial relationship? Is it okay? No, doctor, it's not okay. I'm suffering, really. I'm sorry for that. We can refer you to a specialized doctor in this issue. He can give you some medication to help you in this issue. Okay? Don't forget the endometrial relationship in the social history in this case. Are you supported financially? Do you smoke at all? And advise the patient to stop smoking because smoking can worsen your heart condition. And we can help you in this issue by referring you to smoking cessation clinic. Yes. Okay. Do you drink alcohol? You advise to... Okay, do you drink alcohol? You are advised to stop alcohol as well because alcohol can worsen your heart condition and your liver condition as well. Okay, if you have time, do summary for the patient about what you discussed today. And if you have time, check understanding how much did you get from our discussion today. Don't forget empathy and sympathy. I'm really sorry for these bad informations today, but be sure that we will help you as much as we can to enjoy your life.
تمام.
طبعا الكونسيرن مهمة جدا. لو انت don't have time for يعني summarization and for checking understanding, you ask about the concern directly. وبعدين don't forget about the help for the patient. I'm going to give you some brochures and leaflets to inform you more about your condition. I'll give you also my contact number. If you have any worries or queries at any time, please don't hesitate to contact me. Anyone to arrive you home, Mr. Magdi, thank you. فمعلش يا دكتور حسام انا عايز الابروتش بتاعك يبقى مش انت اللي تستقبل المريض، لا انت اللي بتديله، اوكي؟ عشان ده مجرد سيروجيت وحافظ كلمتين في الاخر او سؤالين هيسالهم وخلاص. افرض ما سالش هتفضل كده محلك سر؟ يعني لا، ما انت لازم تقول الانفورميشنز بتاعتك وبرضه يعني تنتظر السؤال منه يعني. يبقى
معلش الصوت بيقطع اكتر.
in summary بس كده الهيدلاينز بتاع الكيس دي. What is hemochromatosis and the complications and symptoms of hemochromatosis, okay? And management plan of hemochromatosis, including the referral to multidisciplinary team from a gut physician, from the liver physician, brain physician, and the heart physician, gland physician, and internist, social worker, dietitian, and occupational health care to give you the appropriate plan of management. وتقول له اديله hint عن الفينو section, repeated veno section. Don't forget the diet of the patient. What about your diet? Because you are advised not to eat a diet which is rich in iron, like meat, red meat, liver, and the kidneys, and vitamin C. And we'll refer you to a dietitian to talk with you about the details of the list of the treatment, the list of the foods you have to apply. Don't forget about testing, genetic testing for the patient, for the relatives, the sisters, and you have to take history about you have sisters, brothers, children, you have children, how they are doing. Okay, we can offer them genetic testing to know if they have the disease or not. and they can have the benefit from that by discovering the disease early, so we can start the treatment early to avoid complications in the future. And if you agree for that, we can refer you to genetic testing team to talk in details about this test.
تمام.
دي تقريبا البوينتس او الهيدلاينز المفروض not to forget at all.
تمام.
في السوشيال هيستوري الاربع اسئله بتاعتنا ونساله عن الانتيميتريال ريليشن شيب.
السوشيال.
With that you can refer him to a specialized doctor in this issue to help him.
تمام.
Okay, any question in this case?
دي جت في الدايت بتاع الامتحان بتاع مصر
دي جت
المرة
في
دي؟
مصر، وخلي بالك يا دكتور حسام لان دي ممكن تلاقيها عندك في الامتحان. الحالات بيعيدوها بشكل سريع، وبالدايت اللي بتيجي الدايت اللي بعدها بتلاقي نفس الحالات.
تمام.
اوكي.
تمام، شكرا دكتور طارق على المعلومات الجميلة جدا.
توفيق يا دكتور حسام يا رب. Okay, next case was دكتورة مي. دكتورة مي, are you there? دكتورة مي علي?
Hello?
Yes?
Dr. Saad.
Okay. It is a case of communication also. Just came today in the exam. Mrs. Heba is 32 years old. She has been admitted because of pulmonary embolism 2 days back. Her condition is improved now, and she was prescribed Warfarin as outpatient treatment. She read about Warfarin and she is very anxious about the complications of Warfarin for her condition. You are asked to discuss this issue with her. Again, the scenario for Dr. Sarah just joined us.
Okay.
The scenario again. Mrs. Heba is 32 years old. She has been admitted 2 days back because of pulmonary embolism. Her condition is settled now, and the consultant prescribed Warfarin for her. She read about Warfarin in the internet, and she is very anxious about the complication of Warfarin, and she wants to discuss with you this issue.
Dr. Sadiq, he admitted ولا discharged?
He admitted, and she is going to be discharged after condition is improved. هما ابتدوا يجيبوا حالات جديدة ما جاتش قبل كده، كانوا قبل كده بيربيت الكيسز على طول يعني، لكن ابتدوا يجيبوا حالات جديدة يعني. بس استنى هما برضه
ممكنا إخفاء الأمر وما كان همهمة وتململا وتبادل اتهامات داخلية خرج إلى العمل.
لكن استنى هما يجيبوا برضه ريبيت الكيسز يعني.
Okay.
Can you start?
Okay, Dr. Sadiq.
Take your timing, but I heard you saying okay. The 5 minutes before you are going to your station are very important. 5 minutes to put your headlines that you are going to discuss with the patient. Not to forget something important.
دكتور صادق هي ميس ولا ميسيس؟
Mrs.
ميسيس اوكي.
يعني شفت بقى الدقة، يعني الدقة دي أكيد وراها كلام كبير أوي.
Okay, let us start.
Okay.
Okay, good evening. I'm
Good
Dr.
evening,
Amin, Senior Health Officer in the Medical Clinic.
Yes, doctor.
Nice to meet you.
Nice to meet you.
Okay, first I want to confirm that. Okay, first I want to confirm that you are Mrs. Hiba, 32 years old.
Yes, doctor.
Lady. Okay. Mrs. Hiba, we are here today to discuss some issue related to your health problem. That is okay with you?
Yes, doctor.
Okay. Mrs. Hiba, how do you feel now?
I feel okay, doctor. I improved so much than before. Thank you for asking.
Okay, that is right. That is good. Mrs. Hiba, if you don't mind, can you tell me more about your condition?
Yes, doctor.
How much you know about your condition?
Yes, I was admitted the last few days, doctor, because of leg swelling, and they told me that I have, and then I developed short suppress and chest pain, doctor. They told me that I have clot in my leg that showered to my blood conduits of my lungs, doctor. Then they gave me some medications, doctor, to thin my blood. And then my condition is okay now, but the consultant prescribed medication for me called Warfarin. I read about this medication, doctor, and I read a lot about a lot of complications of this treatment, doctor.
Well, Mrs. Hiba, as you know that you are coming with this swelling in your leg and diagnosed as a condition which is called EBT that lead to some sort of clotted in your blood conduit that is shooted in your lung. And diagnose you as pulmonary embolism. That is why the blood doctor decide to put you on this blood thinning medicine. And you should be on this thinning medicine and regular follow-up with a blood doctor.
Yes,
Are you with me,
the
Mrs. Hiba?
consultant told me that I'm going to receive this treatment for a long time. I'm afraid from the complication of this treatment, doctor.
That means your condition will be assessed by the blood doctor in future if you are going to continue on this medicine, or you should be put on for a while and then to stop. This will be followed by the blood doctor. Regarding this blood thinning medicine, it is not a serious one if you follow the instruction of the blood doctor. First, you should be come to the clinic of the blood doctor from time to time to arrange some of the blood tests in a form of which is called INR. That will be put in a fixed range or fixed level. That it show you if you are control on this medicine or not. Because regarding this NR, if there is any increase in this NR, the dose will be modified according to the level of this INR in your blood.
Yes, doctor, but I read about the...
Are you with me, Miss?
Yes, doctor, but I read that this drug can thin my blood and even it can cause bleeding into my brain, doctor. It's something horrible, doctor.
You are right, Mrs. Hiba. You are right, and you're right to make worry about this medicine. But this will happen if you are not follow the instruction well. Or even the dose will prescribe for you, it will be an overdoses. But this will be controlled by the blood doctor who will prescribe for you the dose and arrange the dose accordingly to your INR level in the blood that is I took for you. And according to this INR that is followed from time to time.
This regular follow-up, doctor, can guarantee 100% that I'm not going to complain from any bleeding or from the complication of this treatment, doctor?
We will try the best. With this follow-up of the INR, we will try the best that is you are receiving the appropriate dose for your condition. But I want to threaten you that in a case if you found any bleeding from any orifice of your body, like bleeding from your nostril, or you are throwing off blood, or any bleeding from your waterwork, or there is loose motion associated with any blood, you should be come to emergency department as soon as possible. That means the dose is high and should be decreased accordingly.
Yes, doctor. So if I follow...
Are you with me, Mrs. Hiba?
Yes. If I follow the appropriate dose of warfarin, doctor, and the regular follow-up, I'm not going to complain from any bleeding or complication of the warfarin?
If you are following this structure, and also there is some medicine that will increase and some other will decrease this the activity of this blood thinning medicine in the blood. That is why at any time if you feel any fatigue or if you have any bug in your body and you take medicine, you should first inform the treating doctor that you are taking this medicine to modify the disease, to modify the dose accordingly, either to increase the dose or to decrease the dose according to the medicines that prescribed, because some of the medicine will increase the level of this medicine in the blood, and the other will decrease it in a condition called drug-drug interaction. That is why also you should take a card with you. You should take the card with you, showing that the dose you are took and the level of INR that is follow you with the blood doctor.
Yes, doctor. There is no other alternative treatment
regarding also
than this oral treatment.
Actually, Mrs. Hiba, There is an other treatment, but in your condition, the blood doctor decides that the best interest for you in the time being is this warfarin.
Yes, doctor.
But we can discuss this issue with the blood doctor in a near meeting with him. Also, I want to inform you that, Mrs. Hiba, regarding the diet, there is some diet also that increase the level of this medicine in the blood. That is why I will refer you to diet doctor to give you more information about this diet that which increase the dose of this medicine in the blood.
Yes,
that is
doctor.
okay with you, Mrs. Hiba?
Yes, doctor.
Okay. Mrs. Hiba, can I ask you a private question?
Yes, doctor.
Okay. Are you married, Mrs. Hiba?
I'm married, doctor.
Okay. Do you have children?
I have one child, doctor.
Okay. Do you have any history of repeated attack of miscarriage before?
No, doctor.
Okay. Are you using any contraceptive pill?
No, doctor.
Okay. Are you smoke?
No, doctor.
Are you drinking alcohol?
No, doctor, never.
Okay, that is. Mrs. Hiba, do you have any history of any similar condition like this before in the past?
No,
I mean, that is a blood clot in your blood conduit in your leg or your... Okay, this is the first time. Okay, Mrs. Hiba, I think now I want from you to give me your concerns. Do you have any concern?
For how long I'm going to receive this medication, doctor?
Okay. From information that I gather from you, it seems that this is an idiopathic causes of this blood clot in your blood conduit. Regarding the duration of this medicine, it will be temporary. That is not for your life. But I think this will be decided by the blood doctor that is treating you.
Yes, doctor.
Even we can arrange another.
Long time, but he didn't predict for me what the time exactly, doctor.
Your condition, I think it will be in a month, it's like 3 to 6 months. But I'm not sure about the exact time that you will continue on this medicine. That's why I will refer for your treating doctor.
Yes, doctor.
To give up a hint about your condition. Okay, Mrs. Hiba. Do you have any other concern?
No, doctor.
Okay. Mrs. Hiba, I forget to ask you, any member of your family had similar condition like you, or any history of blood clot in your family?
No, doctor, never.
Okay. Mrs. Hiba, let us to some which are discussed today that you are Mrs. Hiba, 52 years old, came to the hospital complaint of swelling your leg. That is diagnosed as blood clot in your leg that is shooting to your lung. The condition is called pulmonary bleed. The blood doctor decided to give you a toxin medicine in the form of warfarin. You read about this in the internet and you worry about the complication. I give you a hint about this medicine. And that is not serious if you follow the structure of the blood. If you are following the instruction of the blood doctor, and you come to the clinic from time to time to repeat the blood test in a form of INR to show the exact level of this INR. and you should take the card with you, showing the dose that you took and the reading of INR. And also you should inform the treating doctor that, or any doctor you have, give you any medicines that you are on this medicine, to avoid not to give medicines that increase or decrease this medicine. Also, I refer you to dietitian doctor, to give you more hint about medicines, about the diet that is which increase or decrease this medicine. I forget to inform you that if you want to take any contraceptive, you should follow this with our obstetrician and blood doctor, because taking this oral contraceptive either to increase, it will lead to decreased efficacy of this oral contraceptive with this warfarin.
Yes, doctor.
Okay. Mrs. Hiba, can you tell me how much you know about, how much you get from our conversation?
Yes, doctor, I knew that this treatment is very important for my condition to prevent the recurrence of this blood clot in the future. And it has some complications as well. And if I made good follow-up and I received the proper dose, I'm going to avoid these complications. Thank you, doctor, for that.
Okay, thank you.
Time finished. Okay. Well done, Dr. May. We'll do open discussion. Anything may be missed from Dr. Amay?
دكتور صادق
تفضل.
السلام عليكم.
وعليكم السلام.
دكتور صادق السلام عليكم.
دكتور ماجد تفضل.
دكتور صادق حضرتك في وضحتش ايه what is of pulmonary embolism if it is congenital deficiency of coagulant or major risk factor like surgery. According to this course, we can detect how to use Warfarin. So we talk about this question because you didn't.
Let's start, Dr. Magid. We are not the one to detect the dose and for how long the patient is going to receive warfarin, and we are not the one to detect the underlying causes of his.
The patient.
This will be.
The patient asked the doctor.
Yes, so I have to reply.
The patient.
Yes, it varies from one to the others. It may be for 3 months, 6 months, or even forever. And this will be decided by the consultant according to the underlying cause of your condition. But this is if we don't know if it is provoked or non-provoked or hereditary. But if it is recurrent, pulmonary embolism, for example, the patient, of course, will receive forever. Or it is hereditary cause like hereditary thrombophilia or antiphospholipid syndrome will be forever. If it is provoked cause like long journey or pregnancy or immobility or after surgery, it will be for 3 months. If it is unprovoked, it means that there is no obvious underlying cause. It may be for 6 months. So we are not the one to decide for how long the patient is going to receive the treatment. You can tell the patient, the consultant himself is on to decide for how long you are going to take your medication, maybe for 3 months, 6 months, or maybe forever, according to the underlying cause of your condition. Okay, anything else? Okay.
دكتور صادق.
دكتور سارة تفضلي.
دكتور صادق.
ايوه
لو سمحت بالنسبه the plan for pregnancy for this lady, it should be mentioned here.
Of course, it's very important
because it will affect her child.
Of course. So When was your last cycle? Are you planning for pregnancy? If you are planning for pregnancy, you have to inform your blood physician because this treatment can harm your baby.
Affect your baby?
Yeah.
Yes.
But at that time, we can give you alternative treatment given through a needle.
Yes.
Very important, Dr. Amai, to mention.
Yes.
So, like you mentioned, the oral contraceptive pills, you have to mention also the pregnancy.
Yes. Yes, you are right.
Okay, Dr. Amai, do you think that the exam will ask you convinced the patient to take the treatment?
I try.
Yeah.
I try to tell her this medicine.
Did you show the patient the importance of the treatment
Yes.
in her condition? The advantage of the treatment.
I think I try to tell her.
Yeah, this treatment is very important in your condition for prevention of the partial blood clot in the future because you are prone to have blood clots in the future. And if you didn't receive this treatment, you may develop blood clots in the future, and it will be more serious, and we cannot guarantee what will happen in that time. You have to show the advantage of the treatment for the patient to convince the patient. And you have to be honest also. Yes, this treatment has some disadvantage in the form of bleeding. If it is overdose, or even a Dr. Amai, it can be bleeding with the, with a normal therapeutic, with the normal INR, or with therapeutic range of INR. It can be.
That is why I said to her, even during taking this medicine, if you show any bleeding from any piece of your body, you can come to ER as soon as possible.
Yes. Okay, so this treatment has liability for bleeding in the brain or from any body orifice. But we will keep in touch, or keep eye on you for regular follow-up to know that your blood within the therapeutic range, and this treatment within the therapeutic range. The card, very, very, very important to mention the card, and you will be given a card, and your dose will be written there, and your therapeutic range. Very important to mention about the drugs and the diet for this patient. If you are going to have any new drug, you have to inform your blood doctor, because some drugs interact with this treatment so that it can increase the dose or even decrease the dose, and in both times it can affect your condition. And we are going to refer you to a dietitian to give you some the list of food that you have to avoid, because some types of food also can alter the efficacy of this treatment. Very important, Dr. Amai, to mention this sentence. And after you explain the advantage and disadvantage of warfarin, if we outweigh the risk versus the benefit of warfarin, so the benefits are more increasingly than the risk in your condition. Okay? To convince the patient as well.
Okay, all right.
So, very important to mention why warfarin is prescribed for hair, and the advantage and the benefits of warfarin in hair condition. And the disadvantage of warfarin. But regarding this advantage, you are going to keep eye on the patient and for regular follow-up and the regular blood test to know that to know that the treatment is keeping within the therapeutic range, and she is going to receive or to have a card with her regarding the dose and therapeutic range. And don't forget about the new drug the patient is going to receive, and the food list you are going to refer to dietitian to prevent her or to give her the list of the food to avoid, because it may alter the efficacy of this drug. He asked you, Dr. May, about alternative treatment. There is alternative treatment, isn't it?
Yes, there is alternative treatment to Warfarin.
What is it?
Ribapristine, something like that.
Dr. Nagla, what is the alternative treatment?
أي دكتور. What is what?
The alternative treatment for warfarin was low risk bleeding.
دكتور صالح.
أيوة.
ده باجاترين
أسبرين وريباكسوبان.
أسبرين just no. تبي أسبرين.
Ribapristine.
ريفاروكسوبان.
Okay.
Rivaroxaban.
Why, Dr. May, you didn't mention that for the patient?
لأني قلت لها there is alternative medicine, but this will be decided by the blood doctor.
It is very good that you didn't go into this point, because like that you are arguing and do confrontation with the patient and hesitating the patient confidence regarding your consultant. Your consultant decided the treatment, so that you have to keep this treatment and don't make the patient to be hesitated with another treatment. Okay? So you're blind, Will, at this point. Don't forget regarding the planning for pregnancy and oral contraceptive pills. The patient has to inform her OBS doctor and her blood doctor if she is going to take any oral contraceptive pills or planning for pregnancy. At that time, we are going to do multidisciplinary team for her to give her the appropriate care during pregnancy, and this treatment may be harmful to the baby, so that at the time of the pregnancy, we can use another alternative treatment, which is more safe in her condition. Every point here is very important to mention.
دكتور صادق.
تفضل دكتور ماجد.
If the surrogate asked me why you didn't give me the other treatment instead of warfarin, how can I respond?
عشان كده, that's why we don't want to show for the patient that there is another treatment is available. Okay? Not to confuse the patient. Adulan, this treatment was prescribed in the best interest of your condition by the consultant. Okay?
Yes.
عشان don't confuse the patient that there is another treatment with low bleeding risk. Why, doctor, we didn't prescribe this medication for me? Can you, doctor, please prescribe this medication for me? وهتخش انت في متاهة يعني. You insist why warfarin is prescribed, advantage of the warfarin, disadvantage of the warfarin, and how you are going to manage this disadvantage with regular follow-up in the outpatient clinic to check the therapeutic range of her drug, and outweighing the risk versus the benefit of this drug, the benefits are increasingly more than the risk. The diet and the new drug the patient is receiving, don't forget, and pregnancy and oral contraceptive pills.
Also, Dr. Sadiq, is smoking and alcoholic chronic use also can affect the warfarin because it acts as enzyme inducer,
Yes.
right?
I agree with you.
Yes. All right.
I agree with you completely. Okay, anyone want to add anything here? Very interesting case, huh?
لا كده تمام.
Okay, the next case will be station 5. With whom بقى? With Dr. Nagla. Long time she didn't do with us.
Okay, Dr. San.
Okay, Mrs. Heba is 27 years old. She has been complaining of neck lamp for the last 4 weeks for your kind care.
Only neck lamp?
Yes. The net is bad today because a lot of candidates are dropping. I'm not lucky with you.
What is the name of the patient?
Mrs. Heba,
Heba.
How old is she?
27 years old.
27?
Yes.
Good morning, Mrs. Heba. I am Dr. Najla. I am the senior house officer in the clinic. Pleased to meet you.
Nice to meet you, doctor.
Before we start, I want to check the information that I have. You're Mrs. Heba, 27 years old, and you're coming to the clinic complaining of swelling in your neck. Am I right?
Yes, doctor.
Okay. Can you tell me what happened?
Yes, doctor, I have this neck lamp for the last 4 weeks, doctor, which came to me gradually and increasing more in the size, doctor, and irritating me so much.
By examination of the patient, is this central thyroid enlargement?
There is anterior neck lamp with the patient, which is bilateral and diffuse and the regular edge and mobile.
Okay. Okay, Ms. Heba, is this enlargement of your neck lamp is associated with any pain?
No pain, doctor.
Is this associated with increasing of your body temperature?
Sometimes, doctor, I feel high temperature.
Did you measure it?
No, doctor, but I feel a high temperature.
Did you experience any loss of weight?
Yes, doctor, I have loss of weight recently.
How many kilograms?
Maybe 10 kilograms, doctor, in the last 4 weeks.
Intentionally by doing a diet or spontaneously?
No, my appetite is okay, doctor.
What about your bowel motion? Do you have loose motions?
No, doctor.
What about your eyes? Do you have recognized any change of the shape of your eyes?
No, doctor.
Is there any ectophthalmos by examination of the patient?
No, their eye is symptoms are okay with normal.
Did you experience any heart racing, Mrs. Hiba?
No, doctor.
Did you experience any change of the shape of your skin?
No, doctor.
Any problem of your increasing your sweating?
Sometimes I feel this sweating, doctor.
Okay. Would you? Is there any problem like this happened to you before these 4 weeks, Ms. Hiba?
No, doctor. This is the first time.
Do you smoke?
No, doctor.
Do you drink alcohol?
No, doctor.
What is your job, Mrs. Hiba?
I'm a secretary, doctor.
Do you have any problem in swallowing, Mrs. Hiba?
No, doctor.
Did you experience any chest pain?
No, doctor.
Would you mind if I examine you while we are continuing our conversation?
Yes, doctor.
By examination of the face, is there any protrusion of the eyelids, of the eye balls?
No, the eye size is completely normal. There is no eye size at all.
No abnormalities in the shape of the face? No round face?
No.
Okay, by examination of the neck, is there thyroid enlargement?
There is enlargement bilaterally in the anterior surface of the neck, and the lower neck, bilaterally diffuse, irregular edge, mobile, and not tender.
They're not tender, okay. Is there any problem in the lower limb, any peritoneal myxedema?
No.
Okay. Any thyroid acropathy?
No.
Any hoarseness of voice while I'm talking to the patient?
No hoarseness of voice.
Abdominal examination, by chest examination, there is no tachycardia?
No tachycardia.
No enlargement of the lymph nodes of the neck?
There is some submental and submandibular enlargement.
By auscultation of the thyroid gland, is there any berui?
No berui.
Yes?
Berui.
Yes.
There is berui?
No berui.
Oh, is there any tremors of the hands?
No tremors.
Examination of the abdomen of the patient, is there any organomegaly?
No need, doctor. No need. It's okay.
No, okay. Mrs. Hiba, what is your concern?
I'm concerned about this neck lamp, doctor. What could be the cause?
Well, Ms. Hiba, this is a gland present in the front of your neck called the thyroid gland, and it is enlarged by examination. And taking a history from you by losing 10 kilograms within the 4 months with slightly sweating, and in spite of having a good appetite, this raises the possibility of having a problem, the Graves' disease. But maybe it is another problem, as there is enlargement and irregularity of your thyroid gland. So what we need right now is to do some lab tests and to try to detect the function of your thyroid gland, together with do some imaging to the gland to see what is the nature of this enlargement. And then we are going to sit together again and discuss the results and take. Is that okay with you?
Yes, doctor. Is it curable condition, doctor?
Well, I think yes, it's a curable condition, Mrs. Hiba, but let us see first what is going on with your gland and set the plan of management after that.
Yes, doctor.
Concern?
No, doctor.
Okay, thank you, Mr.
Thank you, doctor. والله الدكتورة نجلاء تكرهني أنا عارف. Okay.
دكتور صادق لازم تلبسني في الحيطة كل مرة. سيبني للآخر وتديني الحالة المتينة.
سيبتك الحالات التقيلة يا دكتورة نجلاء.
على قدر أهل العزم يا دكتورة نجلاء.
فاكرة معايا المرة اللي فاتت؟
Okay, what's your diagnosis?
It could be Graves, it could be goiter, it could be thyroid malignancy. Because there is no fever and there is increased loss of weight, I don't know, it could be anything.
Yes, so what about this submandibular lymph nodes, doctor?
Yes, this submandibular lymph nodes could be metastasis of the thyroid.
Did you ask
cancer.
about any lambus and elsewhere in the body, doctor?
No, I didn't.
Yeah, this patient has lambus in the armpit and the down below, doctor.
You are talking about lymphoma.
Yeah.
This fever.
The generalized lymphadenopathy, doctor.
Yes.
Okay. So, if you ask it from the beginning, if you have any neck lamp in other else where else in the body, and the patient replied to you, yes, doctor, I have other lambus. Where in your body? In armpit, doctor, and down below. So, what about your approach now? How you are going to approach the patient?
In this condition, I will tell her that I think, unfortunately, that you have a serious condition and increasing in the lumps all over your body will raise a suspicion of having malignancy. So we have to do some more investigations for you in the form of lab test and maybe a biopsy from these enlargement lumps to know what is the nature of this problem.
About symptoms of this patient in the history.
We will ask again about the malignancy symptoms. I'm asking about loss of weight, loss of appetite, any family history of malignancy, any previous history of malignancy, organomegaly, as lymphoma is usually associated with splenomegaly.
What other causes can cause lymphadenopathy?
A viral infection like cytomegalovirus or Epstein-Barr. Maybe sarcoid or secondary TB.
Yeah, so
any infection condition is
lymphoproliferative disorder or infection like HIV, TB, and cytomegalovirus, Epstein-Barr, and collagen disease,
myeloproliferative,
like sarcoidosis. Yes.
Sarcoidosis, visceral leishmaniasis.
So like that, your approach would be different. So you are going to ask about the malignancy symptoms after you found that this patient has other lambus in the body. So now you are away from a case of Graves' disease. You have to ask about the underlying causes of lymphadenopathy in the form of loss of weight, fever, sweating, and fatigue, being paler than before. And you have to ask about the risk factor for HIV. What about, do you have any history of surgical operations, dental procedures, blood transfusion, sharing needles, piercing, tattooing?
Sharing needles.
Yes, and what about the sexual history? Can I ask private question, please? You have a partner? Do you have any extramarital relationship? This is for all HIV. Do you have any history of contact with TB patient? No, doctor? Okay. Sarcoidosis, do you have any history of joint pain, skin rash, cough, shortness of breath? This is for sarcoidosis. Like that, you finish the case. This is a case of lymphoproliferative disorder. or even myeloproliferative disorder for differential diagnosis. Maybe Hodgkin lymphoma more frequent or more common with female patients this age, maybe non-Hodgkin lymphoma. And we have to exclude other causes
I think
as well, like infection and sarcoidosis. Yes, Dr. Sarah?
Dr. Sadiq, I think Dr. Nadla, Dr. Nadla, if during examination she asked us if this is swelling moving with swollen, he can catch it is not a thyroid.
Yeah, and the thyroid lamp it is moving.
It is lymph node rather than thyroid.
Yeah.
Yes.
I think station 5 would be very difficult without seeing a patient. Imagination is difficult.
Yes.
Then, I always mix up in a station 5 when we are doing it online because I need to see the patient to make a right decision. I think so.
Even Dr. This case came before in Egypt for one of our colleagues. And the swelling and the neck lamp, it mimics the graves exactly. And the patient has supraclavicular lymphadenopathy, which is mimicking graves. And our colleagues, he approached the case like you exactly, that it is a case of graves, okay, nothing else. فبالتالي that's why you have to ask about other lumpus or bumps in the body. أحيانا بيجي lymphadenopathy sometimes mimicking graves, okay, bilateral lower lymphadenopathy, lamp in the lower surface of the neck mimicking graves. So at that time, what investigation you are going to do for the patient, doctor?
I will do basic investigation in the form of complete blood picture to see if there is underlying lymphoproliferative like polycythemia or thrombocytosis or increasing the platelets count. And I would like to do some imaging to be sure there is no organomegaly or internal lymph node enlargement. And we could do some lymph node biopsy. This is the exact. This is the way we can do exact diagnosis.
Yeah, open biopsy. Yeah, what about the staging? CT? Or going to do CT?
Yeah, CT abdomen for staging. Yes.
Abdomen, chest, and pelvis.
CT chest, abdomen. Yes.
Yes, one group above the lymph node, one group above the diaphragm will be stage 1, 2 groups above the diaphragm, 2 groups above and below the diaphragm, and with extra nodal affection. This is 4 stages of lymph node.
So there's we have a stage A and B, and B is the symptoms, okay? So according to the one group in one side of the diaphragm is stage 1, stage 2 is 2 groups on one side of the diaphragm, stage 3 is more than one group in 2 sides of the diaphragm, stage 4 is extra lymphatic extension, whereas B is the symptoms in the form of sweating and fever and loss of weight.
So weight, sweating and fever. And the spleen is considered as a part of lymph nodes. Enlargement of the spleen is not different in the staging.
Yes. Okay, I think Dr. Nagla, I brought a case for you before, a case of difficulty with swallowing.
الثايرويد اللي كانت لابسه البولار. اللي كانت لابسه الاشارب ولما قلعته بقيت فاكرها كويس قوي دكتور صادق ما نسيتهاش في الحقيقه.
ما دي برضه ممكن تكون نفس الاشارب برضه يعني فبرضه هي نفس الحكايه. any neck lamp you don't consider as graves only. You have to put in your mind lymphadenopathy. Commonly, 80% of the cases of neck lamp is lymphadenopathy, not in the exam. I mean in the public. Okay, but in the exam mostly it is graves, but you have to consider that it is lymphadenopathy as well. Is it okay?
Okay.
regarding the investigation, so it will be basic investigation in the form of CBC, kidney function, liver function,
malignant thyroid.
markers. ثانية يا دكتور ماجد بس الناس كمل investigations. CBC including blood smear. Blood smear is very important to see if there is lymphocytosis or not. Electrolytes, kidney function, liver function, inflammatory markers, and the specific investigation of the form of chest X-ray, CT scan for abdomen, chest, and pelvis, and maybe open biopsy to know the definitive diagnosis. تفضل دكتور ماجد. أنا آسف.
معلش يا دكتور، how to differentiate between malignant thyroid and lymphoma. ممكن malignant thyroid cause lymphoma metastasis وتعمل لي confusion في حالة زي كده، ولا صعب يحصل confusion في حالة زي كده؟
والله هو وارد يا دكتور. طبعا عندنا
هي malignant thyroid
types of malignancy of thyroid malignancy. Papillary is the most benign of them, and the most cancerous is medullary cell carcinoma. لكن هيبقى بقى يعني النيك لامب it should be located in the thyroid itself. You will see thyroid enlargement which is moving with the swallowing تمام, and located in the same anatomical site of the thyroid. البيشنت ده مش هتلاقي التيرويد يعني ممكن تكون متغطيه طبعا عشان generalized lymphadenopathy, لكن مش هتلاقيه ده anatomical site, مش هتلاقيه moving with swelling in lymphadenopathy. And thyroid enlargement, it can be moved with swallowing. That's why we have to do the drink test, or the patient to order the patient to take a sip of water to swallow.
اوكي شكرا.
شكرا يا دكتور ماجد. Okay, we finished our cases today. I hope that they were interesting cases. I'm promising you for more interesting cases, more and more. Wait for me soon على القناة الثانية إن شاء الله.
Thank you, Dr. Sadiq.
إن شاء الله. Thank you, Dr. Sadiq.
شكرا يا دكتور صادق. ألف شكر.
السلام
ألف شكر.
أنت شكرا.
السلام عليكم.